Welcome to JBo's Crazy World, continuing education lessons on safety in the workplace.
Ergonomics and well-being.
Ergonomics is the science of designing and arranging the things we use, so we can interact with them more efficiently, safely, and productively, to reduce strain, and keep the body in a healthier posture. Workplace ergonomics aims to reduce the risk of work-related injuries like musculoskeletal disorders while also enhancing overall employee well-being. Ergonomics can be divided into three domains: physical, cognitive, and organizational ergonomics.
Physical ergonomics is concerned with the anatomical, biomechanical, physiological, and anthropometric elements in relation to movement. Cognitive ergonomics is concerned with the mental processes involved in human-system interactions. Organizational ergonomics is concerned with socio-technical elements in relation to employee well-being.
Good ergonomics is all about reducing injury and staying healthy, comfortable, and safe. Our workplace includes not just our work areas, but also our tools and equipment. Ergonomics in the workplace refers to, essentially, fitting the job to the person, rather than forcing the worker to adapt to the job demands to prevent discomfort and injuries like back pain, repetitive strain injuries, and carpal tunnel syndrome. Poor ergonomics can result in overstraining the body over time, causing discomfort or injury, potentially for life. Injuries like carpal tunnel syndrome can be caused by poor posture and lead to potentially irreversible nerve damage in the arm or wrist. Workplace injuries and conditions caused by poor ergonomics can increase healthcare costs for both employees and employers. For example, repetitive strain injuries sometimes require medical treatment, physical therapy, or surgery, which can add to a company's healthcare and workers' compensation costs. Employees who take time off or leave their workplaces due to injuries can incur lost wages and other costs.
Proper ergonomics is important in the workplaces of any industry, particularly ours. In addition to reducing the risk of injury, ergonomics positively impacts productivity and job satisfaction. Material safety data sheets.
Musculoskeletal disorders. Musculoskeletal disorders, MSDs, are injuries that affect the body's muscles, tendons, and nerves, ligaments, joints, cartilage, or spinal discs that are caused by sudden or sustained force, vibration, repetitive motion, or awkward postures, or not the result of any instantaneous non-exertion event, e.g., slips, trips, or falls. May be mild to intense and cause occasional to chronic pain. Can be a leading indicator for disability. Risk factors not related to a job can contribute to or cause MSDs include age, gender, hobbies, smoking, obesity, pregnancy, previous injury, medications, fatigue, physical conditions. Musculoskeletal disorder injuries, MSDs, are often caused by overexertion, awkward postures, and repetitive motions.
One extremely common example of an MSD is carpal tunnel syndrome, a condition where nerves become compressed at the wrist. This compression often results in pain or tingling in the hand and arm. Repetitive hand movements, such as typing, manually shifting gears, and digital expressions often cause carpal tunnel, and the damage can be exacerbated by poor ergonomics in the workplace. For example, if a worker's keyboard or mouse, or a truck's plow system control box, is not at the correct angle or height, it can cause strain on the wrists and hands over time. Alongside physical consequences for the workers, ignoring workplace ergonomics safety can also have negative consequences for employers. Discomfort and pain caused by poor ergonomics can reduce productivity and increase absenteeism. For example, employees who experience discomfort or pain may need to take more frequent breaks, work more slowly, or take time off to recover from an injury caused by workplace strain.
I take the threat very seriously.
Work-related musculoskeletal disorders, WMSDs, can be attributed to the work environment and the performance of work. WMSDs can be caused or worsened by work conditions that require employees to lift, push, pull, or carry many or irregularly shaped objects, maintain awkward, unnatural postures, withstand cold temperatures, withstand vibrations from machinery and tools, increase the intensity, frequency, and duration of activities, Endure psychosocial stressors.
Common psychosocial hazards at work include job demands, low job control, poor support, lack of role clarity, poor organizational change management, inadequate reward and recognition, poor organizational justice, traumatic events, remote or isolated work, poor physical environment, violence and aggression, bullying, harassment, including sexual and gender-based harassment, and conflict or poor workplace relationships and interactions. MSDs have the potential to affect all tissue in the human body, such as the nerves, tendons, tendon sheaths, muscles, and spinal discs. More commonly, MSDs affect areas of the arms and back. Common arm MSDs include tendon disorders such as tendinitis, tenosynovitis, de Quervain's disease, trigger finger, Raynaud's disease, and carpal tunnel syndrome. Tendon disorders often occur at or near the joints where the tendons rub against other tendons, ligaments, or bones. Symptoms include aching sensations, discomfort with specific movements, and tenderness to the touch. CTS, which affects the hands and wrist by compressing and entrapping the median nerve where it passes through the wrist into the hand, causes numbness or severe pain in the wrist and hand. Other symptoms of CTS include a lack of strength in the hand and wrist, and the inability to make a fist. Workers frequently cite back disorders as a common source of pain, and they account for significant loss of production and large compensation costs. Pulled or strained back muscles, or damage to the spinal discs are the most common back injuries. Repetitive pulling and straining causes damage to the back muscles, discs and ligaments, and leads to scarring and weakness that decreases the ability of the worker to support the back. This increases the probability of added injuries. Employees are more likely to be engaged with their work and perform at a higher caliber when they feel comfortable and supported, both mentally and physically, in their various workspaces. These benefits reach beyond the prevention of bodily injury. Addressing ergonomic hazards leads to the prevention of MSDs and an increase in well-being. Ergonomic workplaces help reduce eye strain, headaches, musculoskeletal disorders, and other common workplace discomforts, while employee-focused well-being programs and services further improve employee health, satisfaction, performance, and productivity.